Hey guys, so the CDC just dropped a new document May 1st, right? And it's their new update on the new COVID deaths and the numbers that we're at. Now, we've been going through the whole John Hopkins scaring us 60,000 plus deaths and what's going on. But this information might shock you because somebody's lying. Now, we're going to see a couple videos on how they diagnose deaths and how they're supposed to write it on death certificates. So watch, listen, learn. Tell me what you think.
An influential model just raised its prediction of coronavirus deaths here in the United States. The University of Washington's Institute for Health Metrics and Evaluation now forecasts 74,000 deaths in the United States by August 4th, up from 67,000 in a previous estimate. The Institute's director, Dr. Christopher Murray, is joining us now. Dr. Murray, thanks very much for joining us. Thanks to your whole team for what you guys are doing. Tell us why the new model, the revised version, the death projections, going upward by nearly 7,000 to a total of more than 74,000 people in the U.S. by early August. Why the increase?
Well, there's two things that are driving the increase, and then there's a third that we need to talk about, which is the relaxing social distancing. But the two that are there in the model now are we're seeing case numbers go up. Obviously, testing has shot up in the last 5-6 days. More cases are being picked up. We're trying to make sense of that, but rising case numbers in a number of states. And then we're seeing that the peak of deaths in a number of places is just lasting longer than anyone expected. If you look at other places that implemented social distancing, some of them in Europe hit a peak and came down pretty quickly. And then there's a few that did not, but we're seeing more of these protracted long periods of slow decline, and that's naturally leading to an increased number of deaths. The third factor that's gone into this is a number of states have revised their death numbers. So even going back in the past, we've got people that never got a test, but they're a presumptive COVID death, and that's pushing the numbers up as well. So those are all feeding into what we're seeing in these increased forecasts.
I understand that your model assumes that states won't remove social distancing restrictions until infections drop below 1 per 1 million, but many states are already going ahead with reopening. How is that going to impact your projections? I know you revise them all the time.
Well, we're working.
Important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and fear is a great way to control people, and fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn.
All right, here now we got an article from the National Vital Statistics System, brought to you by the CDC. let's see what they're saying here, where they changed all the information. Now we're going to scroll down and I'm going to show you. COVID deaths. See? We had 60,000, now 37,000. Now we have a document from CBS News dated April 29th, 2020. The U.S. corona death toll topped 60,000 on Wednesday, according to Johns Hopkins University. That's all I'm going to say, guys. The information is there. Alright, guys, so you saw the numbers for yourself. They keep lying to us. They keep telling us more people are dying. Now, the new update, less people died. So they have you running around going crazy because they said 62,000 people died, and now we're at 37,000 people confirmed COVID deaths. So what are we doing? We're going to listen to the lies, or we're going to continue and investigate and do the things that we need to do in order to figure out the truth. Because obviously they're lying.